All right, let's just jump right in. We're not talking about slow, steady progress in healthcare AI anymore. What we're witnessing right now is something else entirely. A massive, sudden acceleration of innovation across the whole medical field. It's happening incredibly fast and it's happening everywhere at once.
And this line really hits the nail on the head. It perfectly captures the feeling of this moment. This isn't some gentle evolution playing out over decades. It's more like a chain reaction of breakthroughs all going off at the same time and fundamentally changing medicine as we speak. So, where does the story even begin? You might think it starts in some sterile, high-tech lab, but nope. We're starting on the ground floor, on the real clinical front lines. This is where AI stops being a theory and starts becoming a reality, driven by the very people who take care of patients every single day. And speaking of the front lines, check this out. The American Nurses Foundation and Hippocratic AI have started giving out microgrants of $10,000. And the key thing here is who they're for. This money isn't going to big tech companies. It's going directly to nurses to fund their AI projects. And this is just so smart because, think about it, who understands the chaotic, complex reality of how a hospital actually works better than a nurse? They see the gaps and the real-world problems that a developer in an office just can't. This whole initiative is about building AI with clinicians, not just for them, which makes all the difference. Okay, so from empowering the people on the ground, let's shift gears to the tools themselves. We're going to do a bit of a lightning round here, looking at a few brand new AI tools that are completely changing the game in diagnostics. We're talking about seeing diseases earlier and more clearly than ever before. First up, let's talk about vision. A team led by Professor Pierce Keen, working with Google DeepMind, has built an AI model they call RET-Found. Its job is pretty incredible. It analyzes scans of your retina and can spot patients at high risk for preventable blindness with the same accuracy as a top human specialist. So what does that actually mean for people? Well, it means catching diseases like age-related macular degeneration, a leading cause of vision loss, way earlier. And in a massive system like the UK's National Health Service, where eye clinics are the busiest department, this is a total game changer. It cuts down on waiting times and, most importantly, it literally saves people's sight. Okay, next up, the heart. Researchers have now developed what they call a multimodal AI. Now, that's just a fancy way of saying it doesn't just look at one thing. It takes the visual data from a heart scan, but then it also reads the clinical notes in the patient's file and combines everything to give a full, comprehensive interpretation. And this is where you really see the power to, democratize healthcare. All of a sudden, getting a top-tier cardiac assessment isn't something that can only happen at a big city hospital. This tech could be revolutionary for rural clinics or places with fewer resources all around the world, giving way more people access to life-saving diagnostics. And for our third breakthrough, we're looking at prostate cancer, which is the most common cancer affecting men in England. The NHS is now piloting an AI system that analyzes MRI scans for signs of the disease. But the real story here is the speed. I mean, just look at that comparison. What used to be an agonizing, stressful wait of weeks for a patient is now crushed down into a single day. The AI can instantly flag high-risk scans, which means a biopsy can happen that very same day. That is a monumental leap forward, not just for efficiency, but for reducing a patient's anxiety. Okay, so we've seen how AI can find disease inside the body. Now let's switch gears and look at the science of creating the medicines themselves. The big question is, how can AI help make new drugs safer right from the very beginning? Now, to really get this next breakthrough, we have to understand one term. It sounds super complex, but the idea behind it is pretty straightforward. The word is toxicogenomics, and all it really means is studying how our genes respond to different chemicals, like a new drug, to predict if it might be harmful before it ever gets near a person. And here is the milestone. A new AI model, using data from 300 different drugs, managed to predict drug-induced liver injury with 100% specificity. Now, that is a very technical term, so let's be clear what it means. It doesn't mean it caught every single bad drug. What it means is that when the AI said a drug was safe for the liver, it was right every single time. It had 0 false positives. That level of precision is just astounding. The implications of this are just enormous. First, it helps prevent dangerous drugs from ever making it to human trials.
And second, it saves drug companies billions by helping them spot failures much, much earlier in the pipeline. It is a massive step forward for making safer and more effective medicines for all of us.
And this incredible predictive power isn't just limited to liver safety. The same basic idea is being used in other areas too. For instance, similar AI models can now look at pathology slides of oral lesions and accurately predict which ones are likely to turn cancerous, allowing doctors to intervene much earlier. So, let's just take a breath for a second. We've seen AI helping nurses, diagnosing major diseases in a single day, and making drug development safer. This incredible, almost unbelievable pace of progress leads us all to one central, critical question.
How soon is too soon? With all this amazing potential, when does an AI tool go from being a cool research paper to being used on you or me? How do we balance this massive potential to save lives with the absolute non-negotiable need for safety and trust? Well, if you think there's an easy answer, there isn't one. The experts themselves are divided. You have the let's go now camp who believe the tech is ready for patient care. Then you've got the cautious group who say, hold on, let's give it 1 to 2 years for more validation. A more conservative group argues for 3 to 5 years to really nail down the safety and regulations. And then there are those who say, not yet, that there are still just too many unknowns.
Ultimately, it really all comes down to this. The technology itself is accelerating like a rocket, but its actual adoption in our hospitals hinges on our ability to build trust with patients and doctors, to prove safety beyond a shadow of a doubt, and to make sure our healthcare systems are even ready for this kind of change. The question isn't if AI will transform medicine. It will. The real question is, how do we choose to guide it? Which of those 4 paths do you think is the right one?